Hello everybody. Today we are in another chapter of our world and abundance of knowledge that I'm going to share with you. The images that you're going to look now, it's about the whole structure of a tooth. I want you to understand and imagine in your brains, how do we know that we have decay? How do the dentist know? How do I trust the dentist that he said we have decay? Well, you have to trust your dentist because you are with a professional person. And also, it helps so much when you have the knowledge to know and understand better to take care of your teeth better. When you look at this image, you look at the crown, you look at the roots of the tooth, but you never imagine what is inside. Inside is a living organism that comes connected from our nerves, a trigeminal nerve, and it comes that also directs innervation to the eye, to the upper maxilla, to the lower teeth. And this innervation that is inside of our body is connected to every single one of our teeth. These teeth go to a special branch. And when you look at the image that I'm showing you right now, and you look how do you go into the canal, you're gonna observe how the canal is full of different structures. It's like you're walking in Mars or something like that. I love this image. It was given to me by Dr. Hebronson. He's dedicated to study the anatomy of the tooth with a lot of visualization and 3D information and impressions. Now, why did I talk to you about this? Because everybody said, well, it's a tooth. No, it's not just a tooth. The tooth is extremely strong, but also it's very fragile. It can break with people that chew eyes. Imagine, I have so many patients that say, Dr. Yagaman, I don't want her to stop chewing eyes. It's just like I talked to Lucasita, my daughter. She is educated to don't chew eyes, chicken bones, because the chicken bones, a lot of people likes to do that, and the teeth will fracture. So the decay, you start knowing you have a different smell in your mouth when you wake up. It's like something is not going well when the food is in the composition. That's the kind of smell. It's really bad when you start having decay, when you don't floss, and especially bacteria start getting into the calcified tissue. How? When you are sleeping and you don't brush your teeth, that's one example, then the defense mechanism is resting. We are sleeping. Bacteria is all awake and is digesting the sugars that we have left in our mouth. When they reproduce, they have an enzyme, which is an acid, and the acid is gonna destroy the teeth, right, Lucasita? Then what is gonna happen? You're not gonna be able to eat. Why? Because the decay bacteria, once it cross, like crossing the border, they cross the border of the enamel, and once they cross that border, that enamel is the white structure that we see outside, then inside the enamel we have tissue that is alive, it's an organic material, it's dentin, it's called dentin, and that is connected with our innervation and circulatory system. So you don't have pain, maybe you have a good threshold of pain and you don't feel any pain. But the bacteria is inside. One is inside and it's close to the nerve, then you start having some pain, a little bit with cold. So we're gonna have another chapter where I'm gonna tell you how did the pain start. Because decay, sometimes you don't have pain when it's small. But as soon as it starts crossing a line in our mouth, in our teeth, you start feeling some pain with cold. The pain will disappear immediately. That means that your decay is getting closer to the nerve. However, to understand this better, I will explain to you through different images. So stay put for our next show, and I will talk to you about how to differentiate a regular pain, like you drink cold water, right? And you say, oh my God, it's really cold. And the sensitivity goes away. Well, sometimes people are whitening the teeth over and over. You create sensitivity. But that doesn't mean you have caries. It means your teeth are sensitive. Then you have to visit your dentist, or you have to send a question to us. And I will be happy to answer what is the best toothpaste to use, how to stop your tooth sensitivity. Again, our next chapter is going to be so interesting. We're going to talk about how decay is going to give you the signs that it's getting close to the nerve and you're going to end up having a root canal. Remember, how are we going to avoid this? Flossing at night and brushing. First flossing, brushing. You can use everything else you want, but flossing and brushing, that's non-negotiable. You have to do it. Remember, this program is about to make you have dental treatment free, which means no treatment. Thank you. If you like what you hear in this chapter, subscribe below, and we will be looking for your comments also on Instagram, Dr. Fanny Yacaman, at your service. Thank you and have a good day.